Hi, Troy Herman here from Herman Physical Therapy and Wellness with my good friend Sean. We're just going to talk to you just a little bit about plantar fasciitis and what that is. I hear a lot of people say that they have heel pain, have bone spurs, and I just want to talk to you a little bit about what that is and some things that you can do for that. First of all, it's typically not the spur that causes the issue. The problem is plantar fasciitis, which is just an inflammation of the plantar fascia. Now, the plantar fascia is on the bottom of the foot, and it kind of supports the arch from in here back down to the heel. And a lot of times people have that pain just right here on that insertion point of that plantar fascia on the back of the heel. First thing in the morning when you step on it, after you've been seated for a while, and then you get up, and those first few steps just feels like somebody's shoving a knife into your heel. So things that we can do for that, number one is try to stretch out the tissue because it gets tight. Sometimes it takes a little more than just stretching the tissue, and I can show you what I typically do with individuals. The other thing that's really important is shoe wear, and that's something that I encourage you to go visit with your physical therapist about, proper shoe wear, because different foot types need different types of shoes. And they'd be somebody that can help you out. Again, my purpose of these videos is to educate you and then also promote physical therapy, because this is Physical Therapy Month. So one of the things I do is, I call it blading, but it's just instrument-assisted soft tissue mobilization. There are several forms out there, Graston, A-stem. You can use different types of tools for this, but I'm going to have Sean go ahead and lay down on his stomach. And typically what I use here, it's called the blade. It's a metal tool, has an edge to it. It's not super sharp, but basically you're going to go through the tissue and try to see if you can break up any adhesions, any scar tissue, try to set off an inflammatory process again. Again, if this is done right, it should be uncomfortable, but it should not be incredibly painful. I see too many therapists try to get too aggressive with the treatment. Doesn't take very long to do that, 5-6 minutes max, a lot, and then you can move on then to stretching the tissue out, which I'll show you the best stretch for this. So I'm going to have Sean do that for us here. Okay, so what we're going to try to do is we're going to stretch both the gastroc soleus muscle that has to go through the Achilles tendon, and then also the plantar fascia itself. So the step stretch is a great way to do that. So what you'll do is you'll get on the step, bottom step, that way if you fall off, you don't fall all the way down the stairs. Bottom step, all of your weight on the left foot to start with for him, and then he's going to set just the ball of his foot on the step, and then he's going to drop the heel down towards the floor, putting as much of the weight through that leg that he can tolerate. Now he can control how aggressive he is with that. You want that stretch to be 30 to 60 seconds, and you can do 2-3 repetitions several times a day. Just control how aggressive you are with that. So a couple of things for plantar fasciitis and or heel pain. Try those out on your own. Get you a good pair of shoes. If that's not enough for you, search out a physical therapist in your area. Come find me, Herman Physical Therapy and Wellness, and you can get taken care of. So give it a shot, and we look forward to next week. And I think next week maybe we'll talk about some spinal stenosis. That sounded good. Spinal stenosis, there we go. And talk to you guys about some things you can do for that. Have a good day.
Good for the body, good for the soul.